I'm Mark Zhang. I'm the founder and president of the American Medical Extended Reality Association, and I'm here at the 10th Annual International VR Healthcare Association International Symposium at Moffitt Cancer Center in Tampa, and we're doing booth tours. So I'm here with AppliedVR. Matthew, good to see you.
Mark, good to see you as well.
Yep. So I just love to learn more about Applied and Reliever.
Yep, all right. So Mark, first of all, it's always awesome to see you here. You're such a great voice in the industry for what we're trying to achieve, and you've been a big support of ours, and we absolutely love it. So Reliever was the first ever FDA-Authorized Class 2 medical device to treat chronic low back pain. We got their FDA clearance back in about 2021, and while that's awesome, it's amazing to be able to get that, that's just the first step. The rest of it is all about how do you actually bring it to market and get coverage in the marketplace for an innovative device like this. And so we were very thoughtful about what we did. We first and foremost wanted to partner with one of the more innovative organizations in the world, that actually happens to be the VA. They've been amazing partners for ours, and we use that to then go and actually work with CMS, Medicare, Medicaid, to be able to actually get the first ever code to cover a VR medical headset. That's code E1905. And so since then, we've been growing at an amazing pace right now, and we've just had great supporters out in the marketplace. And so we'd love to give you a little tour of the headset.
Yeah, I'd love to see it. So yeah, and you guys are really the pioneers of making this happen, not just on the technology, but getting paid for it. Which
I'll tell you, I was at a MDIC conference back in Q4 last year. And there were a couple of us up on stage, and there was a woman that is steeped in the payer side of the equation. And we were sort of just talking about the things we were doing. And she said, hang on, you guys should take a step back and be very happy and grateful for what you've done. We should all be grateful for what you guys have done, because you've really helped pave the way for how people can get paid in the industry. And it was great to be able to take that moment of reflection and say, we have a lot.
Yeah.
I feel humbled, and I just feel blessed that we have this opportunity. And most important, it's about the lives that you impact, and the fact that we can get this on literally tens of thousands of patients to be able to get them to have a life-changing experience.
That's awesome.
That's what it's all about.
Yeah. Well, tell me more about Reliever. Yeah.
So Reliever, this is our device, and you'll notice that this isn't just a normal headset, right? We actually have developed a patented solution, because we're all about how do we actually capture the own biodata, in a sense, to be able to drive the experience. So when we first did some innovation around this, we actually had a pulse oximeter. We'd connect to your finger, Bluetooth connected, and in the laboratory, it was awesome to see how it would actually change and modulate based on your own heart rate variability. When you put that in the real world, and you have someone who's putting it on a headset that's kind of clunky to begin with, and then you got to put a pulse and Bluetooth. I don't have Bluetooth, right? You have these people that would just, there was friction in the equation. And these things still, while they're great, there's still a little bit of friction in how easy to use they are. So we ended up doing a derivative of it, and we actually created a breath shield that we patented. And what we do is, because for our program, breathing is core to it. We actually capture your breath with the actual headset, and then it materializes in the headset, in the experience that you're seeing, so you can see your own breath as you're going through the program. And one of the examples of that, we have a barren, desolate desert, and your breath brings life to the desert. And it's really amazing. And when we talk to our patients after the fact, in a sense, it's like we're planting memories in their brain and teaching them how to control their own central nervous system. And the thing they always talk about, if they have a moment of crisis, or they're in a moment when there's a breakthrough pain for them, take a step back, take a breath, and they visualize that cue, because the power of VR is how we can activate the 5 different core centers of the brain. It's great when you can see it to making that last.
Yeah, I've had the chance to test Reliever a couple of times, and I just love this is my own editorial, but I love the fact that you basically made a controller out of breathing, which is really cool. Right. It's really cool.
So when you think about bringing any device to the marketplace, we think about it as the 3 E's. We're trying to keep things as simple as we can for ourselves here. So the 3 E's are going to be, number one, ease of use. If something is clunky, if it's hard to use, it's going to sit in a corner and it's never going to get touched. So we have been maniacally focused on that. We talk about the breathing as the device basically controlling it. We want no control. We want nothing other than your own body that's on you to that's one. And we're actually easier to use than an iPhone, and Apple loved it when we were sitting down talking to them, and they saw that we're easier than an iPhone to use in such a way.
Yeah.
The second one is it's got to be engaging. So especially in healthcare, right? With our program, it's sequential. Our whole point is that we're going to teach you skills over the course of 56 sessions. It takes about 10 weeks to complete, but getting them to actually go through that program is so important. And this is where the power of VR and the way we created this really kicks in, because it connects with you at an emotional and non-conscious basis. It gives you a sense of awe and wonderment. If you think about healthcare as a whole tends to be a negative thing. People don't want to do the pills, they don't want to do the therapy, they don't want to do the workouts they have to do. But they do it when they do it, so they can get respite on the other side. VR actually flips it on its head. VR actually, it gives you that sense of awe and wonderment. It makes you want to do the therapy. And oh, by the way, on the other side of it, then you get respite from afflictions. And so our adherence rates, pilot with one of the largest payer systems in the U.S., and they said we were in the top 5% of any device that they had ever tested.
Wow.
And so we are consistently in the 70 to 80% range of adherence for people going through the program, which is just phenomenal. When most people, honestly, you're lucky if you get 5, 10, 20%.
Yeah.
Even cancer. 50%.
What's the third E?
The 30, thank you, is going to be efficacy. So obviously, it's got to work.
Yeah.
But I'll argue that if you get ease of use, that means they're going to pick up the device. And then you get the engagement, they're going to use it consistently, then they're going to get effect. And so with ours, we always are rooted in science for everything that we do. We have multiple double-blind RCTs that we published, and some in your research.
Journal of Medical Extended Reality. Yep.
And so for us, we actually look at post-treatment, and then we track it for 2 years after the fact, because we want to show that it's not just all because of the mindset, but that they're actually getting lasting benefits. And so we track them for 2 years, and we want to demonstrate that for about 70 to 80% of those patients that have benefits at the end of treatment, that it persists for 2 years, which is amazing to show that we're really tapping into that neuroplasticity of the brain.
Wow. That's really cool, Matthew. So where can people learn more about Reliever and AppliedVR?
So Reliever, the best way to do is if you are in the VA, make sure you go talk to your physician about that, or you can always go to reliever.com. And if you are on the website, AppliedVR.io. And then obviously if you're in the commercial side or not a part of the VA, then definitely go talk to your doctor. But again, sometimes they don't know. We're still trying to educate the marketplace on this. So make sure you go to the website and you can even download a prescription you can take to your doctor.
Awesome. Well, thanks so much.
Mark, awesome talking to you.
All right.